So, as Lisa said, I am Carrie Cuffman, and I am a developmental behavioral pediatrician at Cleveland Clinic Children's, and I'm going to be talking today about autism and sleep challenges. So, our learning objectives for today, and what I'm hoping to go over with all of you, is to identify why so many children with autism spectrum disorder have problems with sleep. And then we'll spend the bulk of our time talking about learning how to pinpoint and address possible causes of your child's sleep problems. And then we'll spend a little time at the end kind of talking about how to determine when to get a medical provider involved and how they might be able to help. So let's first talk a little bit about the connection between autism spectrum disorder and sleep. So if your child with autism has sleep troubles, you are far from alone. As many as half to 80% of children with ASD have sleep troubles, so a huge part of the population does. It is very, very common. There are three main categories that I think about to families when I'm meeting with them and thinking about kind of why a child with autism or other developmental delays or typical children have sleep troubles. So the first area I think about is behavioral. So that doesn't mean your child has a behavioral problem. It just means that your child has something that they're doing, some habit or something in their routine that is not optimized for them to be able to sleep at night. And we'll spend a lot of time talking about some of these behavioral things that prevent good sleep. There are, of course, also medical causes of sleep problems, and I'll go through a long list of those and we'll talk about those further, but they do, include a wide range of things from eczema and itching to growth pains to sleep apnea and more. And then there are also in children with autism biologically based causes of sleep trouble. And so I'll talk a little bit about that in the next few slides as well. So as I mentioned, so behavioral causes occur due to some habit that interferes with good sleep. As the second part of the talk will be dwelling on this quite a lot, so I won't dwell on it more here, but suffice it to say that behavioral causes are one of the easiest things to intervene on, and in studies, it's been shown that fixing a lot of these behavioral things actually go a long way towards fixing sleep problems in general, even when other things are going on like medical causes. So here's a long list of medical causes. So reflux, cough and asthma, sleep apnea. So if your child's snoring, that's especially a young child with snoring is a big red flag for sleep apnea. Eczema and itching, dental pain, restless leg syndrome can be a cause of disrupted sleep. Seizures can cause disrupted sleep, pain anywhere, and then mental health concerns as well. So anxiety and depression. Medications that your child has taken, particularly like stimulants, can cause sleep problems. So that'd be Adderall or Ritalin, methylphenidates, amphetamines. And then iron deficiency has also been linked to some restless sleep as well. And we'll kind of revisit these throughout the talk as we talk about various specific sleep problems. So then there are several hypotheses about why kids with autism in particular might have this, increased propensity toward trouble with sleep. So one is that there might be some differences in children's with autism, their brainwave organization or their maturation that can cause disruptions in sleep. There have also been some hypotheses and studies that have looked at genes and genetic changes that are related to what we call the circadian system. So the circadian system is the kind of the clock setting and how your body knows when it's time to go to sleep. And so there have been some changes found in kids with autism in some of those genes at times. There's also been some concerns about abnormalities in a hormone called melatonin. And melatonin is another hormone that probably many of you have heard about because it can be taken as a supplement. But in kids with autism, there have been some studies that have shown that either their melatonin is released at different times or it's not peaking like it should be at the time of sleep onset. There are also some studies that have looked at kind of arousal levels. So maybe kids with autism are more at a higher arousal level, so it's just harder for them to calm down their brain, and as well as sensory hyperreactivity, which is somewhat biologically based, which we all know that kids with autism can have some sensory hyperreactivity. So those are the main biological causes that we see in kids with autism and sleep problems. Okay, so let's talk, we're moving on to the next section of our talk now, about kind of being a detective for your child's sleep problems and really thinking about what might be causing your child's sleep problems. So first of all, the first thing that I would like you to do is really think about your sleep habits with me as I go through this. So I like to think about in 4 main sections. So consistency and timing, the bedtime routine, your sleep environment, and your daytime habits. And we're going to go to each of these in a little more detail next. So consistency and timing. It is really, really important and optimal that bedtime and wake time occur around the same time each day, including weekends. So on weekends, there should really be no more than an hour of kind of difference, especially in the wake time. And so you can really kind of set yourself up for success by making everything really consistent as far as the timing of when your child goes to sleep and when they wake up. Of course, this is not always possible, but as much as it is possible, trying to make it very consistent can be really helpful. And then even going as far as kind of consistency and timing of other routines throughout the day can also be very helpful. So having meals at approximately the same time each day. And then of course, naps at the same time each day and not too late in the afternoon. So for younger kids who are still taking naps, probably waking up at the latest around 4 p.m. And then really if your child is, around 5 or over, they probably do not need naps anymore. And if they're napping, then that could be a cause for concern. And if they're napping and not able to fall asleep at night, that might be a reason why. Okay, so that was consistency and timing. So next is a bedtime routine. So the bedtime routine is really, really important and helpful in kind of setting the stage and setting your child up for falling asleep well, okay? So, because it's really about getting your child's brain and body ready for sleep. So it should be relatively short, and include just a few steps. So it shouldn't be long and complex and take you all over the house. The length being about 15 to 30 minutes is right for most kids. And for younger children, the younger they are, the shorter it can be. Each activity within the routine should be something that is relatively easy, so something that is not frustrating for your child. Homework should not be a part of your bedtime routine, and relaxing for your child. So if there's something that gets them really keyed up, that is not something to do during the bedtime routine. So avoid things such as, stimulating video games, even most screen is probably not a great idea to include during the bedtime routine in general. And anything, roughhousing, wrestling, that sort of thing is probably not think about including in your routine. Might be things more like, coloring, reading a favorite book, playing with a favorite, calming toy. If your child enjoys doing relaxation strategies, maybe you do some, kind of guided imagery or progressive relaxation. Those sorts of things can be really calming for some children. So think about kind of what types of things that your child finds relaxing, and those should be the things that are in the routine. As I mentioned, really trying to avoid screens in general is a good rule of thumb, because in addition to them being somewhat stimulating, they can, the light from screens can inhibit melatonin production, and then that causes problems with falling asleep. The activities in general, when you're thinking about kind of what order you should put them in, you should move in location across your house towards the bedroom. So you don't want to be kind of zigzagging across your house in and out of the bedroom as you're doing this bedtime routine. So it should kind of logically make sense to get you up towards the bedroom as you're going through your routine. So maybe you start down in the living room with something, and then do, brushing teeth and stuff in the bathroom, and then do your last thing in the bedroom. And it should really be about the same each night. So there shouldn't be much variation, because as I mentioned, it's really kind of setting the stage and getting their brain and body ready for sleep. So it should really be about the same each night. Okay. One thing that can also be helpful for bedtime routines for some children with autism is doing a visual schedule of the routine, so they know what's coming, because kids with autism really like to be able to kind of see on a visual schedule what things are going to look like for their day. And so the bedtime routine is also one of those times. So particularly if your child is having a hard time getting through the bedtime routine, using one of these bedtime routine visual schedules can be really, really helpful. And this is just an example of one, but you can take your own pictures of your child doing the various things, or of the various special bear and things like that, or special story that you read, and then make your own visual schedule as well. Okay, so we've talked about consistency and timing, so everything should be about the same time, and then having a really nice bedtime routine is really important. The third thing that I mentioned was sleep environment. So this includes many things that I think people don't always think about. So I think temperature is something we certainly think about for ourselves when we're sleeping. So not too hot, certainly a little on the cool side, but not too cold is probably best for sleep. Thinking about light is really important too. So if your child is afraid of the dark, having just one night light, or a calming light that they like, making sure that if there's a lot of light coming in through the window, to put up blackout curtains or things like that, because dark really does improve sleep. Think about the comfort of bedding in pajamas. So for kids with autism, this probably makes a huge difference, more than it does for neurotypical children, because they are so much more sensitive to those textures and things. So what type of bedding do you think they would like? Is it silky and smooth is better, or soft and cuddly? And the pajamas too, is there something itchy about them that is bothering your child at night? So really kind of thinking about what types of fabrics and things your child generally likes, and making sure their bedding and pajamas is consistent with that. Thinking about noise. Is there a train that goes by your house every night and wakes them up at 3 in the morning, and then they can't go back to sleep? Is there something we can do about that? So maybe adding a white noise machine, or if there's some sort of calming music that they enjoy, that you could kind of play at a very with noise is the other noises in the room, as far as, is there a TV in the room, which I would strongly discourage, as when it's on, TV noise isn't consistent, so it really can be disruptive for many kids. So thinking about kind of what noise is there in the bedroom, and how can we kind of work with that. Scents, is there any scent that your child really likes that they find calming, that maybe they might like to have, a diffuser or something in their room that they could associate that with bed? And then also thinking about other objects in the room or the bed that could be either disruptive to your child or calming. So piles of stuffed animals on the bed can be very disruptive for some children. Some having special or very preferred toys in the bedroom can be very distracting and keep kids up at night. So if you can, keeping those sorts of things out of the room, and keeping in the room, a special toy that they like to rub or something like that, can be really helpful. And then also thinking about other people in the room or in the bed. So are there siblings in the room that are disruptive to your child? Are they sleeping in your bed? And how is everybody kind of getting along with that? So usually in their own room, in their own bed, is most conducive for sleep for most people once kids get used to it. Okay, so last kind of category here is daytime habits. So thinking about your day, physical activity during the day is very, very helpful for sleep at night. So getting at least 1 hour of active time during the day is the goal. And then also thinking about kind of light and dark and how you're using that during the day. So light in the morning helps you wake up, dark in the evening helps you fall asleep. So thinking about how you can you dim the lights in your house as we're getting closer to bedtime to make it more conducive for sleep. And again, making that room nice and dark. Caffeine is the next thing. So thinking about is your child having, pop after, in the late afternoon or evening, is that stopping them from falling asleep in the evening, because kids with autism can be very, very sensitive to caffeine. So if you're really struggling, cutting out mostly, completely might be a really good thing to think about changing. And then napping, as I mentioned earlier. So is your child ready to drop their nap? Is this nap in the afternoon or going too late to the evening, stopping them from sleeping at night? And then also think about use of the bed and the bedroom during the day. So the bed and the bedroom should really be used mostly for sleep, particularly if you're struggling with sleep, because we want it to be mostly associated with falling asleep. If your child's spending a lot of time in their bed or in their bedroom not sleeping, that can actually have an effect on nighttime sleep. And then thinking about stress and anxiety during the day is really good as well. As I'm sure, we all know, when you have a stressful day, it can sometimes be hard to wind down at night. So, help giving your child coping strategies to deal with stress and anxiety so that by the time they get to bed, they're not as keyed up and still anxious and then having a hard time falling asleep. Okay. So that's all about kind of, behavioral modifications and kind of analyzing our habits around sleep. So hopefully you kind of were able to think through with me and pinpoint some things you could optimize for your own child. So let's turn a little bit to think about things in a little different way and talk about some common sleep problems. So these are the ones that I hear most often from my patients who have autism, the things that are tripping them up. So first we'll talk about some bedtime resistance and trouble falling asleep. I know I got several questions about that. Then I'll move to overnight awakenings and then early morning awakenings. And for each of these common sleep problems, we're going to kind of look at it from the frame of, what behavioral things could affect this, what medical things, and what biological things could affect this. So that'll be kind of our roadmap going forward. Okay, so first is bedtime resistance and trouble falling asleep. So there are a lot of behavioral things that can affect this. So the first one that I didn't talk about a lot before, but wanted to point out is the wrong bedtime. So this graph over here is a good demonstration of why putting a child to bed just a little bit early is actually a really bad thing. So we have two drives to help us go to sleep. And these two graphs up here show them. I won't go into the nitty gritty, but basically, so the homeostatic sleep drive is one that the longer you have been awake, the more sleepy you get, which I think makes sense to all of us. The circadian sleep drive actually, so you get, after you wake up, you slowly get more and more awake, and it actually peaks right before bed, and then there's this drop off where you get much sleepier. So when you combine those two graphs and two things driving sleep, what you actually get is there's actually this bump up in alertness right before bed. So if you're putting your child to bed just a little bit too early, they may actually struggle quite a bit to fall asleep. So if you're, especially as your child's getting older, they were doing okay in the past, but then now they're not doing so well going to bed at this bedtime, think about moving the bedtime back by a half hour or an hour, because you might be getting into this bedtime forbidden zone here. Other behavioral things that are culprits for bedtime resistance and trouble falling asleep. One I hear a lot is, there's no bedtime routine in place, or the routine we're doing isn't very calming and has some elements in it that that are, very stimulating for the child. Daytime habits, of course, can have a huge impact on bedtime resistance and trouble falling asleep because they, you're drinking caffeine late, you're napping late, all of that can have, and you're not getting active time, so you're not, your body's not as tired when you're going to bed, all of that. Analyzing those daytime habits is really, really useful for pinpointing where the trouble is with falling asleep. And then again, sleep environment has a big role in this as well. Okay. So one tool that I wanted to talk about that's particularly good kind of for bedtime resistance and those curtain calls. So if your child is getting out of bed frequently or out of their room frequently to say, hey, I need to eat, but drink water, or sorts of things. This is good for kind of preschool or older children, is the Bedtime Pass. So the Bedtime Pass is a actual physical pass that you give your child, and the theory behind the pass is they can exchange the pass for one trip out of their room. So a visit from the parent, a drink of water, a hug, a kiss, a bathroom trip for once. But if they have it in the morning, they get a small reward for keeping it all night. So it can be a good motivating tool to help your child stay in their bedroom at night if they're having a lot of these kind of curtain calls. The other thing I'll say about this is if your child is having a ton of curtain calls, start with more than one bedtime pass, because just coming out of your room once is not very achievable for a child who is like starting it coming out of the room 10 times. So we want to make it something they can succeed at. So start with, if they're coming out 10 times, start with 7 bedtime passes so that it's something they can feel successful at and quickly get some rewards in the morning from keeping some of those passes. And then as they get better at it, dwindle down the number of bedtime passes you're giving. So that's a nice little tool to be aware of. Okay, so the medical causes for bedtime resistance and trouble falling asleep are many, but the ones I wanted to highlight were anxiety. So of course, if your mind is racing and you're nervous about things, this is one of the most common kind of mental health problems that I encounter for falling asleep. And then ADHD, if your child has a diagnosis of ADHD, can also, kids are just, more hyper, more on the go. They have a little more trouble calming down their body. And so putting into place some of the things I already mentioned is even more important for these, as well as treating them well with appropriate medications and coping strategies, behavioral strategies. So the other medical cause that I really want to highlight is medications. So as I mentioned earlier in the talk, stimulants, so any of the methylphenidates or amphetamine salts can, if they're taken too late in the day, or it's a long-acting form that kind of reaches into the evening, can really cause some trouble falling asleep for kids. And then some of the SSRIs, so these are medications for anxiety or depression, so things like Prozac or Zoloft, can also cause some trouble falling asleep. They can also make kids drowsy, ironically. They can do both, but if your child is on one of these medications and they started having more trouble falling asleep when you started it, you can always take the medication in the morning rather than the evening for the SSRIs at least. So those are some of the medical causes I wanted to highlight. And then the biological cause that I wanted to highlight, I think all of the biological causes play into all of these sleep problems. But for melatonin abnormalities and falling asleep, there's something we can do about it. So I wanted to be sure to mention it and highlight it in this section. So using melatonin, a few guidelines for everybody. So the doses that have been studied and found most helpful in children with autism are really the relatively low doses. So they're about 1 to 5 milligrams or so. Once you get above 5 milligrams, those doses haven't been shown to be very effective, and there could be potentially more side effects with them. Although melatonin tends to be a relatively safe and side effect-free medication, some people do have side effects with it. you really should take melatonin, or your child should take melatonin about 30 to 60 minutes before bed, because the goal of melatonin is not necessarily to make your child drowsy, although for some children it does do that. But the goal of melatonin is really to work more like the way it does in your body, which is to help set your sleep clock. Excuse me. So when your melatonin is released, your body says, oh, it's time for me to start getting ready for sleep. And so really we should be using the supplemental melatonin in a very similar way. The other thing I'll say about melatonin is it's best when it's used with some of those behavioral strategies that I mentioned. If you're not doing any of those behavioral and environmental things, melatonin is unlikely to work super well for you. The other thing I'll say about melatonin is that it really helps with falling asleep more than it helps with staying asleep. And that's the way melatonin works in your body too. There are so there's two different forms of melatonin. There's kind of this immediate release form, which is, all come as you take it. And there also is an extended release form. And there's some thought that the extended release form may actually work better to help kids stay asleep longer, but that has really not been well studied and isn't 100% known yet. So for now, the jury's kind of out on that, and probably either the immediate release or the extended release is fine. If you want to try both, you can get both over the counter or through Amazon. And so there is that difference to be aware of, though. Okay, so I did get one question about kind of teenagers in particular. And there aren't too many things that are specific to teenagers that we need to think about, except for this one. Otherwise, for the person who asked those questions, pretty much everything I'm saying also applies to teenagers. But in teenagers specifically, when teenagers go through puberty, as I'm sure you might remember, so the clock shifts in puberty to a later sleep onset time. So, so biologically, all teenagers are just programmed to want to fall asleep later. So when you're thinking about your kid going into puberty and they all of a sudden have trouble falling asleep at their previous bedtime, think about whether you need to delay that bedtime by 30 minutes or an hour or so. That being said, even though their clock is shifting, they still need about 9 hours of sleep in their teenage years. So it's still important to try and make sure they're getting that as best as we can. The other problem that I run into most with my teenagers is that they can get in trouble with a lack of consistency between the weekdays and the weekends because they go to bed later on the weekends and then wake up later on the weekends and then have trouble falling asleep on, Sunday night. And that bleeds into the rest of the week, right? So really making sure as much as possible, again, to have some consistency between the weekdays and the weekends, that's really still key for teenagers, even though they, might want a little bit more independence. But really kind of thinking about that and monitoring when your child is falling asleep on weekdays and weekends, and not making sure they don't get too shifted on the weekends to a later sleep clock. Okay, so that was about kind of the main things to think about with bedtime resistance and falling asleep. I did have another couple of questions that I wanted to make sure I addressed in this section. So I did get a question about individuals with autism kind of reprocessing or kind of re-going over their events conversations at the end of the day. And so when we're thinking about sleep onset for everyone, but even, particularly for children with autism, and even children with autism throughout the day, children with autism do tend to have more kind of self-talk than other children. So yeah, the answer is yes, it is relatively common. And, I think that that's probably a coping skill that your child is using. And so that's, perfectly fine to do. And then I also got a question about sleep onset and rocking. which is probably a self-soothing mechanism that that child is doing. And so that is actually very common for children with autism, as well as kind of you'll see it in younger children who are neurotypical as well, is kind of probably has a self-soothing capability, but we do see that more often in children with autism, and it really is nothing to be concerned about. Okay, so let's move on a little bit to overnight awakenings. Okay, so what are the behavioral causes of overnight awakenings? So one big one and a new concept I want to introduce to you is sleep onset associations. So a sleep onset association is when, so we have one set of conditions in one environment when we fall asleep. And so the way I think about it is we expect when we wake up for everything to be about the same in the environment as it was when we went to sleep. So everyone wakes up some overnight. So most of the time, for most people, they kind of wake up briefly when their sleep cycle ends, do kind of a status check of the environment, and then go back to sleep as long as, you know, your bladder's not too full or something like that, in which case your brain says, oh, I need to get up and go to the bathroom. But when there's a sleep onset association with something has changed in the environment, so for example, if the child falls asleep and the parent is there with them when they fall asleep, when they do this, you know, every, you know, hour and a half or 2 hour wake up at the end of a sleep cycle, they wake up and they say, their brain says, this is odd. The things aren't the same in the environment. I need to wake up further and get things back to how they were so I can fall asleep again. So sometimes when kids are having a lot of overnight awakenings, it's because they have these associations with falling asleep that then aren't satisfied overnight because the environment's different. And then they need things to go back to the way they were to fall back asleep. And so the worst ones are when you need the parent's presence because that disrupts your sleep, right? So, so that is how these sleep onset associations cause problems with overnight awakenings. Other behavioral or environmental things that cause overnight awakenings are, of course, the sleep environment. Is there a noise waking them up? Is the scratchy sheet bothering them? Is light from the window coming in? So thinking about that and how you might kind of address that. And then, of course, daytime habits. So especially if they're not getting enough active time during the day, not or sleeping too much, napping too much during the day, those overnight awakenings that are usually just kind of brief for everyone, they might not be tired enough to fall back asleep. Medical reasons for overnight awakenings that I wanted to be sure to mention include, so parasomnias. Parasomnias is the medical term for things like sleepwalking, sleep talking, and night terrors are the big ones. And so those can look very similar to overnight awakenings. And so night terrors tend to be in the early part of the night, and your child wakes up and would be screaming, but would seem that they aren't awake. Okay, so they might not be responsive to you, and then should hopefully go back to sleep without anything, not without waking up. So those can all look like overnight awakenings and can be associated with overnight awakenings, but are really relatively harmless. And the thing we want to do during these is just make sure the child is safe. So make sure, if they're sleepwalking, that they're not falling down the stairs or walking out of the house. And then nightmares and anxiety can also cause overnight awakenings. So nightmares in opposite night terrors, nightmares usually happen in the second half of the night, and your child will be awake and will be scared and upset, but will seem awake. So that can be another major cause for kind of waking up in the middle of the night and screaming. And then anxiety can also play a role in nightmares, right? So they can travel together, but then anxiety also can, once the child wakes up and they're awake and then they start thinking about things, then that anxiety can keep them awake too. And then most of the other medical problems can cause overnight awakening. So sleep apnea is a major, major culprit. So again, snoring, pausing, gasping, and breathing during sleep are big red flags for sleep apnea. Reflux. So if they're having, heartburn, eczema, and itching, and pretty much any of those medical, that big long list of medical things can cause overnight awakenings. So really kind of thinking about how your child is doing from that medical perspective is good when you're thinking about overnight awakenings as well. Okay, so let's talk a little bit more about the sleep associations, because I think this is something that many people struggle with, and what to do about them. So the way to fix the sleep association, so these are the things that your child, needs you again in the middle of the night in order to fall back to sleep after waking up. So how do we fix this? So the way to fix it is to teach your child to fall asleep on their own. And so there are a couple of methods to doing this. In infancy, and only in infancy really, the cry it out method is the most commonly used. That doesn't work for many reasons in older children, not least because they can get up and come find you, right? But also it does, for an anxious kid, that's very, upsetting. So it really doesn't work in older children. So there are a couple of methods that you can use. This first method is my less preferred method, but I wanted to go over it because it can, for some kids, this is the right one. So the first method is checking in method. So you say goodnight and then leave, and then you come back and kind of check in briefly on your child. So the first night you would say goodnight, leave the room, maybe 3 or 4 minutes later, depending on how your kid's doing. You come back in, check in briefly, say, hey, Johnny, it's okay. Don't make it too big of a deal of the check-in. It's time to go to sleep, and then kind of leave. And then you kind of lengthen the time between your visits over time. I think this tends to be difficult for with most kids with autism, and it's certainly difficult for anxious kids because that time with the check-ins just, their brain just starts going, and it really just makes them more anxious, and they're not likely to fall asleep well. So the method that I like better and is typically more successful is what's called fading. So a fading parental presence. So if you're used to, for example, lying in bed with the child, so the first night of doing this, you might lie in bed with them, but have a pillow in between you. The next night you might lie a little farther on the bed. The next night you might sit up in a chair. Or the next couple nights, depending on how your child is doing with it. And then sit a little farther from the bed each night until you're in the hallway. And then, the last night is they can see your hand in the door, but most of you is out of sight, and they fall asleep that way. Okay, so this is a more gentle way of dealing with a sleep association. And I did get kind of one question about kind of a 4-year-old boy who needs the kind of deep pressure and tactile input to fall asleep. And this is something you could consider trying for that as well. I think that gradually lightening the pressure you're giving on him, if it's something, especially if you're doing it while he falls asleep, it might be a strategy you could try, for that child as well. If you haven't tried a weighted blanket or something, or a vest or something like that, that also might be a good kind of replacement for your giving that deep pressure. Okay, moving right along to early morning awakenings. So these, I will be honest, tend to be the hardest to do anything about. For the main reason is that it does have this biological cause, in that it is for many children with autism a normal sleeping pattern. So kids with autism tend often to just need less sleep. So this is just normal for them. They wake up and they're awake. But there are other things we can fix before just kind of accepting that this is going to be the case, right? So thinking about the behavioral aspects of the bedtime timing. Are they going to bed too early? And that's why they're waking up so rested early in the morning. And then your daytime habits too, especially things like, active time and napping can have big effects on early morning awakenings. The other medical cause that I really have seen associated with the early morning awakenings, inability to fall back asleep, is depression and anxiety. So if your child is having, mental health concerns, certainly looking at those and helping with that might help with these early morning awakenings. So, if you've looked at the behavioral aspects and the medical aspects, what do we do about it? So, if your child's able, giving them something to do on their own. You can also use some visual cues to help him or her know when it is okay to leave the bedroom. So for many kids, kind of a clock with a red or green light. So when the light switches to green, they're allowed to come out and bother you, can be a good solution, or even something as simple as, a stop sign on their door that tells them to stay in their room until you come and take it down, can work for many children. So working with your child's biologically set clock can be just kind of what we have to do in this case. Okay, so last section of the talk. So, help. When do we involve medical providers? So of course, if you have a concern for a medical cause of a sleep disturbance. So reflux, so if your child's having, sour burps or a lot of heartburn, cough and asthma, of course, can be a real concern and really disrupting for kids at night. And, particularly with asthma, there tend to be a lot of night coughing. So if your child is coughing a lot at night, seeing your primary care pediatrician or about that, or if your child has a diagnosis of asthma, they might need a change in their asthma medication. Sleep apnea, as I mentioned, snoring, particularly a young kid, but also in older kids, pausing, gasping for breathing, along with morning headaches, excessive daytime sleepiness, and a lot of sweating when you sleep can all be symptoms of sleep apnea. Itching from eczema can be a big cause. So, making sure we're really treating that. And if they're having a lot of itching, maybe even considering, an antihistamine before bed. Dental problems and dental pain can be a big deal. And of course, cause sleep disturbance. So it's really important for children, but especially children with autism who may not be able to tell us, to have regular follow-up with a dentist. Restless leg syndrome or periodic limb movement disorder. So if your child is very restless during sleep, it might be that. And then seizures can disrupt sleep as well. So if your child is having, odd movements at night, or again is waking up and throwing up in the middle of the night, those would certainly be things that are concerning for seizures. Parasomnias, like I mentioned, sleepwalking, sleep talking, the night terrors can be a medical cause of sleep disturbance. And the only reason we tend to worry about parasomnias is if they are, a little bit on the unusual side and look like a seizure, and then we might do a sleep study to evaluate that. Pain. So pain anywhere, growing pains, any pain can disrupt sleep. As I mentioned, the anxiety and depression can be big causes of sleep disruptions and medications. And I will say what I also like, anxiety in children with autism, often what it looks like is kind of increased rigidity and increased difficulty with kind of transitions, especially in kind of nonverbal kids. That can be what that looks like. So if you're seeing that in your child, talking to your health professionals about that can be good. Okay. The other reason to see a medical professional is when behavioral interventions just aren't working. So you've tried, all these things that I've said, and for a couple of months, because, implementing behavioral strategies, as I'm sure many of you are aware, it doesn't happen overnight. It takes time. But if you tried for several months and really haven't seen much success, then it might be time to kind of talk to somebody about it, right? So medical prescribers can decide if a medication is indicated or if a, further workup is indicated. Do we need to get a sleep study to look at that, or have you see the sleep medicine doctors to kind of look further into some of those medical reasons that I mentioned? And then there are psychologists that specialize in sleep that can really help fine tune some behavioral strategies for you. So you're trying all these things, but we all know kids with autism can be difficult to implement behavioral strategies with. And so if you really just need somebody to help you with some of these strategies, they can be good sounding boards and can help troubleshoot you, because it's this whole discipline of sleep psychology, because sleep can be very difficult. Okay. So here are a couple references. The book at the top is one of my favorites, so Solving Sleep Problems in Children with Autism Spectrum Disorder. It's a relatively short book, but it has a ton of helpful information and just really helpful kind of resources and information about sleep in children with autism. And then Autism Speaks does have several toolkits for children, teens, and then one talking more specifically about melatonin. So I'll leave those up on the screen. And there were a couple questions that I just wanted to kind of go back and make sure I answered, because they didn't necessarily fit quite in the talk. So, I think that I got one question about weaning the pacifier for nap and bedtime in a 2.5-year-old. And, when should we tackle that? And I think that is a complex question to answer. But, I think that as children get older, we do need to think about weaning the pacifier, because it can cause some, dental and oral problems. So at 2.5 years, you're, still in a good range, but, kind of picking your time well when you're maybe prepared to get a little bit less sleep. So when not a lot of other transitions are happening, and, when things are relatively quiet, right? If that ever happens. But, picking your time when you want to do it, when you want to kind of wean off the pacifier and making a plan for it will be a good thing in the long run. And then somebody also asked, which I didn't directly address when I was talking about melatonin. So is melatonin safe to use for an extended period of time? And yes, it absolutely is. It is non-habit forming. You can use it for, as long as your child needs it. I think that was all the questions. I think those are the only two that I see on my list that I didn't addressed. So I hope this was helpful for everyone, and I really appreciate having the opportunity to talk with everybody. And I hope that I hear from some of you with other specific questions for me. So thanks for having me today.
Thank you, Dr. Kaufman. That was awesome.
Good.
I had a couple of questions for you as I was listening. Melatonin for me and my son, we were kind of told that melatonin that you should take a break from it at some point. So we used to do our schedule 5 days on and 2 days off. Mm-hmm. I don't know if you have any comments or thoughts on that process.
Yeah, so I have heard that from some people, but I think there's not a lot of evidence behind that. I think for some people, some people do kind of find that it is less effective the longer you take it. And so I think the reasoning behind it is that if you're taking a few days off, but I think that most of the sleep medicine folks really do encourage kind of taking it every day. So I think that melatonin is nice because it's relatively, it's safe, and relatively effective and has a lot of good evidence. And so if you find that doing it that way does work a little better for you, I think that's a fine schedule too. But most of what I've heard about melatonin is to, taking it every day is okay too. Great question.
What about exercise? So sometimes, exercising before bed for some folks is great. Sometimes it's not. So a lot of families, now that it's getting warmer outside, we're going to try and get outside. We're going to try and take a walk after dinner. And how's that going to affect our sleep?
Yeah. So, I think that you're absolutely right that, I would try to make sure we have in place a nice right before bed, maybe in that 30 minutes before bed, having nice calming things. So not running around outside, screaming for that 30 minutes. But, I think that it is kind of a balance of finding that time to get in the active time too. So I think that I would encourage it. And I think it's somewhat family and child dependent as to how it affects your sleep, right? So if you find that your child is one that really can't handle that, try and get it in early, active time in earlier during the day. But if it's something, a nice calming walk is good for your child, then I would say go for it. So I think it is definitely kind of person and child and family dependent.
Gotcha. And then the other thing I would say is, you talked about the rocking and some of the things that parents might see their kids do before bed, and that some of those might be a calming strategy.
Yes.
So for my son, he actually bounces on his therapy ball in the dark before he climbs in bed. And so I think it would be also pertinent to say, try to determine what the purpose of it is. And if it is for a calming strategy, don't stop it.
Yes, absolutely. And most of those, I think, are good calming strategies. That body movement is soothing for many kids.
Yes. All right. This was awesome. Thank you so much. For folks that are still watching, there will be a survey that comes up on the screen afterwards. So if you can let us know how we're doing and if we're meeting your needs, we'd like to have your feedback. And I will send out tomorrow a link to the recording as well as Dr. Kaufman's slides so that you can use those as reference. And let us know what questions you have, and I'll pass those on to Dr. Kaufman and we'll get those answers pushed back out to you. So I hope you're able to enjoy some of this beautiful weather and that we can hopefully get together soon. But if there's anything else that you guys need, please do reach out, and have a wonderful evening. Bye, guys. Thank you.
Bye. Thanks for coming.